Hello everybody, last time we talked about the implementation and intervention of how to work with people who experience traumatic experiences in their life. And that's called trauma-informed approach treatment. Today I want to go a little bit detailed about how those traumatic experiences may impact a person's life and how their social content, social culture has a significant impact on the way you provide a treatment to your customer, to the client. So the important thing that you need to know is trauma-informed. This terminology has to do with people who have, let's say, suffered experiences during the past. That could be either childhood or middle-age crisis or any drastic social changes in their life that could impact their ability to function. Divorce, family issue, problem with difficulty interacting with other people, all those can turn into the drastic event, and then they may need seeking for support in terms of how, as a clinician, you can help them to develop some sort of skill to improve the outcome of the treatment. A lot of time, people who come to your clinic or come from different backgrounds and seeking for support, they may tell you that, okay, they suffer from extensive trauma, but without recognizing that their trauma may be impacted by their social culture, which means that their childhood, their average childhood, their difficulty manage their culture when they were younger, or some significantly childhood trauma has not been exposed by them. So they don't know or they're not aware or recognize that part of the trauma can create a significant impact when they were growing up, when they are seeking for treatment. So as a clinician or counselor, your job is to explore in those areas, find out the targeting reason why the client or the consumer is not able to resolve all those problems in their life. And one important thing is because they don't recognize those issues, so they may not be able to tell you what's going on. A lot of times can be a little subconscious. They are not able to function because it's subconscious. It could be lingering in their brain somewhere, memory, but they're not able to recall all those sensitive events that happened to their life because that could be hidden, that could be avoiding because they're not wanting to discuss this issue. Even though they want to, but subconsciously they decide not to disclose that information to you. So last video we talked about all those interventions, but we also mentioned about confidentiality. We're talking about how to expose those areas without offending, right? Without explore their weakness, without some critical issue that may happen. If you're not delegating carefully, the treatment can be failure. So recognizing important goes through from the social culture perspective is important, and then you can utilize all those interventions I taught you on the last video to support the client, help them to walk on their own feet and make sure that they can become independent. So all those things are very important to discuss, and there's a reason why I want to talk about the social culture perspective. The concept is important because we need to make sure and we'll be able to understand that part of aspect is important. If they don't recognize it, sometimes they don't talk to you about it, and you have to understand the process and how to work with it, not just focusing on substance abuse. Yes, substance abuse may be part of the reason, but if you're talking about trauma informed, you need to incorporate in those care, provide a lot of empathy, sympathy, and care for those clients who really need to seek for those support. On the other side, if you're talking about implementing the strategy, if you are helping the client to regularize those issues, then you also need to talk about thinking about how to support him to confront those beliefs and what is a skillful way to reveal those past negative emotions when you address those issues. So all those things are very important in the way of manage the mental health, manage the physical health. You just have to find that angle to support the client to move on with their life without feel regret and suffer. And those suffer can be a lifelong suffer, but your job as a counselor, clinician, or if you are just a case manager, you have to make sure you care yourself and you help the client to walk through their past traumatic experiences so they can become more positive and get a better life